Now coming to the middle ear structures again, we have the stapes. Now stapes is in continuation with the internal ear. The internal ear is also called as a labyrinth. We have this oval window and the round window. From the oval window, the vestibule is in communication. Now what happens is the sound waves from the stapes move on because we have something called as a foot plate of the stapes. The stapes will have a foot plate and this keeps vibrating the oval window so that the vibrations will go from the middle ear cavity to the inner ear cavity. Now there is a condition called as otosclerosis. Oto means ear and sclerosis means hardening. So you should also think of a condition called as Presbyacusis. Especially the elderly people, they just can't hear at a normal level, at the usual threshold level. At this foot plate, it gets calcified and degenerated. Now the stapes cannot move because it is now fixed calcium deposition. So this condition is called as otosclerosis and this would result in presbyacusis, which is a normal deafness of aged patients or aged people. So here in this case, they do a technique called as mobilization. They tend to move the stapes. This is called as mobilization of stapes. If the physician is going to drill out, they do a natural drilling to remove the excess calcium. In that case, we have something called as foot plate drill out. Okay, so you will have to report the codes accordingly. So invariably, these patients would have deafness as a symptom because of otosclerosis.